You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. Each day in the emergency department, we see dozens of patients who come in with issues related to their breathing. Many of these patients are older adults, people who have been smoking for a long time, and unfortunately not taking good care of their health. Many of these patients are diagnosed with COPD, chronic obstructive pulmonary disease, and that's what we're going to talk about today. COPD is extremely common, and it's estimated that more than 5% of the population is actually diagnosed with COPD. It is the number 3 cause of death in the United States. This year, more than 120,000 people will die directly as a result of COPD. Now, COPD is a condition that is chronic. It is not curable, but it is manageable. And there are 2 primary types of COPD. The first one is called chronic bronchitis. So chronic bronchitis is different than acute bronchitis. Acute bronchitis is generally a cold or a cough, maybe some fever. It'll linger for a week or 2, and then it goes away. Some people may go to the emergency room or the urgent care or see their family doctor, and they may receive antibiotics or cough medicine, and they improve back to their normal status. Chronic bronchitis is different because it lasts for at least 3 months, and it lasts for at least 2 years. The key is that you have to exclude other causes, which include things like pneumonia and the flu. So chronic bronchitis means the cough simply will not go away, and it continues to cause symptoms and issues regardless of the treatment. So that's called chronic bronchitis. Now, the other type of COPD is called emphysema. Emphysema relates to structural changes that occur, and these can actually be seen on an X-ray. The spots that we see on the X-ray are related to the alveoli. So alveoli are the very small sacs at the end of the bronchial tubes. So when you take a deep breath, all the air goes into the lungs to inflate it, and the alveoli are small pockets where the air is right before it crosses into the blood. So this is a very, very important part of the respiratory cycle. If the alveoli are damaged, the air, the oxygen, can't exchange into the blood, and the carbon dioxide from the blood can't exchange back into the lungs. So that pathway is disrupted. So COPD can be determined by either chronic bronchitis or emphysema. The difference is that emphysema, you can see it visually on an X-ray, whereas with chronic bronchitis, you can hear the cough and the mucus, but the X-ray may be completely normal. Now, some people have both chronic bronchitis and emphysema, so there's quite a bit of overlap between that. A lot of the questions that I receive from patients are regarding asthma. They'll ask, well, what's the difference between asthma and COPD? And that's a good point, because there are many people who actually have asthma and COPD. The primary difference is that COPD is caused by cigarette smoking and exposure to certain toxic chemicals, whereas asthma typically develops in children and it improves as they get older. So think of COPD as a disease of older adults after many years of exposure to chemicals and tobacco, whereas asthma is typically related to children. Now, it is possible that you can have asthma and COPD at the same time. The treatments are slightly different, but that is becoming a major issue, especially across the United States. Now, the issues that we talked about for symptom control. So with the chronic bronchitis, it's going to be taking medications like mucolytics, meaning something to break up the mucus. It may require daily cough suppressants, may require inhalers, especially if there's wheezing or tightness in the chest. And also people will end up on oxygen. So supplemental oxygen is the only thing that's been proven to prevent death in this population of people. Now, people are often embarrassed by wearing oxygen. They don't want to wear it out in public. They don't want to wear it at work. They don't want to wear it when they go to family events. It makes them feel old or disabled. But oxygen is so necessary. Again, because the alveoli may be damaged, So the oxygen and the carbon dioxide exchange is disrupted. So oxygen has been proven to keep people out of the emergency room, out of the hospital, and to help them prevent death. It also helps with a lot of the symptoms, especially the shortness of breath, which can actually cause anxiety and insomnia. So we highly recommend people consider oxygen if it's something they and their family members feel comfortable with. Now, what are the other treatment plans for COPD besides the inhalers and the cough medicines? Some people may need steroids, especially if the wheezing is very bad. They may need a steroid shot or steroid pills to get them through a week or two when they're particularly ill. Other people may require antibiotics, especially if they run a fever or they have signs of pneumonia. Now, any illness on top of COPD is a high risk for morbidity and mortality, meaning it can make the patient much worse, almost disabled, and it can lead to death. So anytime somebody develops the flu, if they do get an infection, if they have poorly controlled issues such as diabetes or heart problems, and they have COPD, a lot of times those patients will have to be admitted to the hospital just to remain stabilized. Most of them will end up on antibiotics and antiviral medication as well. Now there's pulmonary function testing, also called spirometry. So that's one of the ways that we measure the ability of a person to breathe in and out. So PFTs or spirometry are non-invasive. These are very easy tests to do in the office, and it gives us a baseline. So once we do some measurements from the pulmonary function testing, we have a printout. If we check it a year later or 5 years later or 10 years later, we expect that their function is going to decline. They are going to get worse, but this just gives us objective information regarding that. Now, one of the treatments that has been shown to be beneficial is called pulmonary rehabilitation, also called pulmonary rehab. So this is kind of like physical therapy, but it's really for the lungs. And this is usually performed at a hospital or a specialized clinic. The key is that it involves therapy that you can do at home as well as things you can do at the center. And oftentimes there will be a team. So there may be a nurse and a respiratory therapist, there may be a dietitian, there may be your doctor or a pulmonologist involved as well. So these are all experts in their field working together to keep that patient out of the hospital. Again, that's always the key. We're trying to keep people out of the emergency department, trying to keep people out of the hospital, because that's the way to prevent death in those situations. Pulmonary rehabilitation oftentimes involves a lot of hard work, but it pays off because those people feel better. They're able to enjoy life, they're able to walk, they're able to eat and sleep more comfortably, but you do need a referral to attend pulmonary rehabilitation, and it will take some time to get the full benefits and the full effects. So this is something to consider if you or a family member are having COPD symptoms or issues with fatigue related to the breathing. You may want to ask for a referral to a pulmonary rehab center, and they can do an assessment and then give you some advice regarding that. Now, the American Lung Association also offers some resources, and their phone number is 1-800-586-4872. Again, that's the American Lung Association, 1-800-586-4872. And I do recommend that people who have COPD or other breathing issues visit their website. It's www.lung.org. So it's very easy to go to the American Lung Association's website. You can click on the COPD tab, and it has a whole section regarding pulmonary rehabilitation. So I strongly encourage you to review some of that content, and then hopefully you can get a better sense of the things that we've talked about today. So again, COPD, it's divided into chronic bronchitis or emphysema. The treatments are primarily related to oxygen, maybe include inhalers, steroids, possibly antibiotics when there's an infection, and then pulmonary rehabilitation is a good thing. This is something very important, and it should be combined with pulmonary function testing, PFTs. So all of this information will be available on the show notes later today. You can always visit our website, simplehealthradio.com, to get more information. If you come across some additional information or infographics that would be beneficial for us and our patients, please send them to us via social media. If you have questions related to COPD or other topics, you can also visit our website, simplehealthradio.com, and visit us on social media to send us your questions, and that way I can answer them on one of our future episodes. So I hope you learned a little bit of information about COPD, and I look forward to having you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.